If you have a root canal, mercury fillings in your mouth, or any dental problems, this next episode is gonna make you smile. Let's go, go, go.
Welcome to the Healthy Reasonings podcast with Dr. Andre. You are now listening to your number one source for clear, unfiltered conversations about your health and wellness. Join us every Tuesday for success stories, educational topics, and interviews with wellness experts from around the world. You can listen to this podcast on your computer, phone, or any other electronic device that streams podcasts, or download each episode and listen to it on the go. Let's get started with today's episode.
All right, welcome back to another episode of the Healthy Reasonings podcast. Today we're talking about teeth, and I guess a good disclaimer to make at this point would be that I am not a dentist. I'm not trained in dental surgery, but I am a medical doctor. And again, I want to remind everybody that the advice being given here is not advice about your specific medical condition. So if you have a medical concern that you think you need to have addressed, find a healthcare practitioner that would be able to help you, one in your local area, or there's a nice place called Teshuva Wellness that I've heard does virtual consultations. You can reach out to us and let's see if we can help you over video conference. So we're on, I think I've heard somewhere that this is the number one podcast for clear, unfiltered information about your health and wellness. And I think this should be episode 41. And I'm Dr. Andre Williams. I am an integrative oncologist and essentially just an integrative medical specialist living in Jamaica, West Indies, but practicing worldwide where a variety of different technologies. Now, just got back from another trip to the United States. So, I guess this is another late night podcast, and it's also another time when I'm tired. But I think I've heard that I actually perform, slightly differently when I'm tired, not better, not worse. So that means the insights you're going to get this evening tonight are probably going to be maybe a little bit more raw because I'm going to be a little bit more vulnerable because I need to sleep. Hope you guys watched that episode 39, I think it was, on sleep. And I think if we're going to talk about the teeth, first, we need to establish a few things. In Jamaica, we normally say that when somebody smiles, they show all 32 of their teeth. And generally speaking, the expectation is that we have 32 teeth in the mouth. And most people assume that the teeth are primarily for their intended purpose, which is to chew, to what we call masticate, I guess the word is, and to help you to digest food by mechanically breaking down the food. But how many of us know that there's a direct link between the teeth and several chronic diseases? And this is not just me being a healthy reasoner. This is well documented across the medical literature that there's a link between your dental health and your overall health. So we're going to talk about why. But before we do, let's take a quick break so we can get these things out of the way.
Are you feeling tired, drained, or just unable to do daily tasks? Here at Teshuva Wellness, we have the best solutions designed to restore your energy and balance. Our IV vitamin infusions blend essential vitamins and minerals that deliver the energy you need, right where your body needs it most. This allows you to quickly get back to your best self. Some benefits include improved hydration, enhanced immune function, increased energy levels, electrolyte replenishment, detoxification support, and improved skin health. Whether you're fighting fatigue, boosting immunity, or simply looking to feel your best, our IV vitamin infusions are a natural choice. Return to your best self, feel stronger, more resilient, and more balanced. Ready for a natural boost? Visit Teshava Wellness today. Your health journey begins here.
All right, we're back. So we're talking about the teeth. And so we have 32 teeth. And the general thing to note is that the nerves coming off the brain, coming off, the nerves that are originating in the brain, before they even get to the spinal cord, the involuntary nerves, the autonomic nerves, the ones that we can't really control, are already sending off branches to the head, the face, and of course the teeth. Which means that the autonomic nervous system, in a very real way, has some of its first circuits being formed in the teeth. And so the way I like to think of the teeth, because the nerves need to go through the jaw and terminate in the teeth themselves, and that's what gives you the ability to have sensation in the teeth, first of all. And a lot of people don't realize that when the teeth are coming together, there's actually sensation and signals being sent back and forth between the teeth and the brain, so that you don't crunch too hard between your top tooth and your bottom tooth. Bet you didn't know that. So there's a sensor that prevents you when you're chewing from chewing down on the other tooth. So there's a need for you to have electrical supply to the teeth so you can know if something is wrong with them, because they're critical to help them with their blood supply. And most of us at some point or other have had a toothache. And we know that the pain signals coming from the teeth are some of the strongest one can ever feel. So I like to think of the teeth in two ways. One is I think of the teeth as structurally being bony objects that are used to help to, because they're so tough, they'll help to chew, to crunch, to crush, whatever is necessary. And so the structure of the tooth is that you have this bony outward part that we can see, and you have the inner part, which I think is called a pulp, which you can just imagine is a lot of blood vessels and nerves flowing into the tooth. But electrically, I picture each tooth almost like a tiny little light bulb that's screwed into the socket of the jaw. So if you think of it in both ways, then you can see how structurally the health of the teeth can affect the entire body. We'll talk about that in a brief moment. And also electrically, how the circuit that is formed within the tooth, the light bulb that's there, can actually affect your health as well. So let's start with structurally. Structurally, because the teeth are embedded in the jaw, picture a light bulb screwed into the jaw, then it means that in a way, it's not so easy for the body to send the immune system, soldiers, cells, whatever, into that area to keep it clean. And remember, we spoke during sleep about the need for drainage of excess inflammation and so on off the teeth and down into the gutters below the collarbone. So the question is then, if there is damage to the tooth by way of infection, mechanical damage, something of that sort, then it sets you up for an area of the body that's more or less closed off from from the rest of the body having access to it, because it's deep into the bone. And in a way, if the inflammation or infection becomes overwhelming, then there's a potential for that to be a hidden source of infection and inflammation in the body that we as doctors, unless we're looking for it, might not necessarily pick up on. So for example, let's say you have what we in Jamaica call a bad tooth. What you're really saying is there is some amount of tooth decay, there's damage to the bony structure of the tooth, but more importantly, there's damage inside the tooth itself because the tooth is hollow. So inside the tooth, there's an accumulation of probably inflammation, maybe lots of infection, bacteria, and so on. And as a result of that, there's a potential for like a little, well, the word is actually pocket of infection to be trapped in that area. And the body will constantly be getting these alarms that something is wrong there, but it doesn't really know how to address the issue because the area is kind of inaccessible to what it wants to do. It's not open to the rest of the body. So, as a result of that, many times I have seen patients who will come in with a chronic illness, particularly autoimmune illnesses, or further along the spectrum, lymphomas, leukemias. And because of the structural damage to the tooth, the body is constantly being irritated over and over and trying to fix a problem, over and over unsuccessfully. And that creates, on the one hand, this autoimmune effect where it appears that the body is now trying to attack itself, or at the worst case scenario, lymphoma or leukemia, where the body's reaction is so overblown that it just has these abnormal cells, renegade cells, all over the place, and spreading throughout the body as well. So if we're not careful, we may miss in a patient with one of those illnesses that there's a tooth that's damaged. Now, I want to be very clear that I'm not a dentist. I said it earlier, and I have the greatest respect for dentists, which is what many of my newfound dental colleagues will tell you. And so I rely on a lot of my dental friends to help me to figure out what's going on with the teeth, especially if I do a vital reflex scan, watch the video before, and I find that there's a reflex changing right at the level of the teeth, which happens more often than you'll imagine. I'll ask the dentist, say, hey, take a look at this tooth and help me to figure out what could be wrong there, because something is not quite right. The reflex is changing there. And in our story section, I'm going to try to remember to tell you a very significant story that happened, that kind of that propelled me into doing this even more often than I used to in the past. So structurally, if there is damage to the tooth, or in some cases, the damage may be due to actual dental intervention. So when I say damage, I don't mean that the dentist is at fault, but I do mean that the body perceives whatever the dentist has put into the mouth as foreign, and as a result, as a source of irritation or a stimulus for attack. And again, the result is usually the same, because that foreign agent in the body, though it is classified as safe, is perceived as being unsafe to the body, and the body is not quite sure if it wants it there. And as a result, it can be a source of constant irritation. So that's structurally. So that applies to root canals, amalgams, and so on. And this is not to say explicitly that root canals or amalgams are bad, but that the body may perceive them as bad because there's a structural breach there and it's irritated by whatever material is present. All right, so we'll leave that in terms of structurally. We're going to talk about electrically. Now, as I mentioned before, there is actually a nerve supply to the tooth, running into the tooth itself. That's why when there's tooth decay, sometimes the patient will say, boy, I feel like there's a nerve here that's just off. I'm having pain shooting to my ear or something like that. And it's difficult. It's really difficult because electrically, again, it's the equivalent of having a light bulb plugged in, but there's something wrong with where it screws in, or the wiring to the light bulb is not done properly, or there's a raw wire somewhere. Now we open up the possibility of not just the structural damage irritating the body, but remember we said that the body operates as one continuous circuit with little tiny circuits, 32 circuits in the mouth in the form of teeth. So that means that depending on the tooth that's affected, when the nerve or electrical wire is running from the source, which is the brain, to the tooth, it also has wires that are running elsewhere in the body. And the truth is, without giving away all of my secrets, you'll have to be a patient of mine to get the added information. But the truth is that these circuits are actually quite predictable because they correspond to what the Chinese call meridians. And so we can actually, in many cases, plot based on a patient's symptoms, based on what the vital reflex scan shows. We can use that to guide us into where there might be a problem with a tooth. And it means that if we can, with the assistance of the dentist, if we can fix that tooth, correct the problem, then we're actually in business. And I'm going to tell you some stories about that. But let's just say, for example, that the patient has a pain in their right big toe. We can actually check based on our knowledge of how the circuits run and say, based on this pain, we think that your problem may be related to this tooth. Let's investigate and see what's happening. Have the dentist take a look and give us an opinion. So I enjoy doing my work because, as I'll share in the stories, it opens up an opportunity for people who would have conditions that are otherwise what I call wastebasket conditions, meaning nobody really knows what causes them. Nobody really knows how to solve the problem to help the patient heal completely. So we've learned to suppress the body in an attempt to help. So for example, autoimmune illnesses, lupus, rheumatoid arthritis, scleroderma, all of the fancy ones. Many times teeth are involved and are a part of the story. I'm not saying that there's a solution to the story, but there's almost always a tooth that's affected in some way when these patients have these issues. So electrically, we then realize that correcting what's happening with the tooth has a potential to correct the wider body as far away as the feet. Let's take a quick break and I'll tell you some stories. I know the dentists are going to love this episode because I love the work that dentists do, and so should you. And if you haven't been to the dentist in a while, you know what you need to do after this episode. We'll be right back.
Imagine a breakthrough medical technique that gives you precise information about your health with just the touch of a hand.
The Vital Reflex Scan is a tool that I would not want to do without. It is a technique that I use every single day for every single patient, especially if I'm meeting you for the first time. I enjoy doing the test because it is simple, accurate, and helps to identify the root cause of why you are sick. It does not require you to remove any clothing, but you will need to remove your jewelry. You will not have any special wires or equipment attached to you. All you'll have to do is lie comfortably on the examination bed. The Vital Reflex Scan is based on the principle of autonomic response testing. There are some reflexes that the body just does automatically. If you doubt me, try sneezing with your eyes open. These are your most vital reflexes that literally keep you alive. During complete health, the reflex responses we get are normal, but when the body is not regulating well, the reflex changes when we stimulate the damaged areas. To do the scan, we place a small device behind the head to help us measure your reflexes. Then we stimulate different areas of the body and use your reflex responses to determine where you are having difficulty. With this information, we can check what's happening with each organ and each region of the body. The test is very accurate because you can't fake your reflexes. In the Vital Reflex Plus scan, we can even identify the supplements or remedies that would work best for you. Let's take a closer look at what I actually do. I rest my hand on the area of the body that I think that I want to get information on. And I'll use an assistant who is a third party who will help me to measure the results. I'm trying to find the area where the body is blocked, where the reflex changes. And when I find the blocks, I'm no longer treating the condition that you have described to me. For example, I'm no longer treating diabetes or hypertension or lupus or even cancer. What I'm doing is slowly finding ways to eliminate those blocks so that your body can get itself back into balance. At Teshuva Wellness, we believe that everybody has a unique story, and the Vital Reflex scan allows us to listen to your body's story. We're not here to treat just a symptom. We're here to understand the underlying causes of your discomfort or disease. This approach sets us apart and makes us different because it empowers us to partner with your body in its healing journey. We're not guessing about what might work. Instead, we're using precise insights to guide our recommendations, all while keeping our treatments gentle, effective, and aligned with your body's natural rhythms. Thank you for taking the time to learn about the Vital Reflex scan, and I invite you to book your first appointment with us here at Teshuva Wellness, where we're here to help you to return to your best self.
Don't wait. Book your appointment right now. Call us today at 876-787-8197.
All right, so we're back, and the first story I'm going to tell is one of my favorites. And I want to reassure you that my stories are told in exquisite detail, but the detail does not include any identification for the patient. And I also could have seen this patient 20 years ago, or 20 hours ago, or 20 weeks ago, 20 months. In this particular case, I'm going to tell you that I saw this patient about 7 or 8 years ago. And at the time, I had just gotten back from training in Seattle at a workshop held at Bastyr. And I'd learned all about the teeth and how much what I just shared with you is relevant. The electrical solutions that we can find by just helping the teeth. So I landed in one of my colleagues' office. I was seeing patients there for the day. And she sent me a very interesting lady. This lady had a pituitary tumor. Pituitary is a tiny gland in the brain that controls hormones. And so she had just done surgery to have the tumor removed. And that surgery is pretty interesting because they go through the nostril to get to the brain. They do a very precise surgery to have the pituitary tumor removed. And so here she is in my office. I'm already fascinated by the fact that she's had this surgery and is looking awesome. But she says to me, "Doc, ever since I did that surgery, I've realized that I can't feel the right side of my face at all." And my instinct initially was to say, that sounds like a problem for the neurosurgeon who did the case. But in this particular instance, I had just come back fresh from my training. I said, all right, great. Let's see what this could be. So I examined her, and my first thought was, this could be originating from a tooth. So what I did was I used my map to figure out what circuit does a pituitary run on. And I found, hey, pituitary runs on the circuit with these other things. So I said to her, well, based on what I'm seeing, you may also have some right shoulder pain or something. And she said, come to think of it, yeah, ever since the surgery, I've not been able to raise my right shoulder well because it's so painful. And I said, oh, this is interesting. So now I have 2 areas of the body that are on one circuit. And I can kind of piece things together now. I can say, so it's kind of like those old pepper lights. For those of you who remember pepper lights growing up, and it is this long string of really, pretty lights. But if one bulb blew, then invariably the other one would also blow for some reason, and so the whole circuit would be dead. And it's the same thing with, largely, it's the same thing with the teeth. So I traced it to two particular teeth, and I said, "Hey, do you have any problems with these teeth?" And it turns out she did. In fact, she had required the dentist to put in amalgam fillings in those teeth. And I said to her, I just learned something that could help you. Do you mind if I do an injection around the teeth to see if we can correct this circuit? And I'll be honest with you, healthy reasoners, my thought was that maybe she would feel a little better. My thought was that maybe she would say, "Oh, well, thank you for trying, but, I don't feel any difference." But what actually happened was I injected the teeth, and within maybe 30 seconds, this bright smile broke out on her face. I said, "What's going on?" She said, "Doc, as soon as you did the injection, I literally could feel the sensation to my right side coming back completely. And within like 2 minutes, she said, I can completely feel my face again." And I said, "Well, that is absolutely fascinating. Can you raise your shoulder?" And she said, "Oh my God, I can raise my shoulder." And that took 2 or 3 minutes max. And of course, the next step would be to have her go and see her dentist to look a little bit more closely at what's currently the status of the teeth, because I'm not a dentist. But just imagine being able to help that lady long term, which we did, to get her face, her sensation back, her shoulder stiffness gone, and so on. Imagine what that means for her, notwithstanding the fact that she had the surgery and so on. It's really a life changer. So that's story number one. Story number two, equally impressive. This was maybe the next year or two after this incident with this lady. A gentleman came to see me. He was vacationing in Jamaica for a while. And he came to see me. I can't quite remember what his complaint was. But the whole point is, after examining him, I found that, again, the problem seemed to be related to a circuit damage with one of his teeth, left jaw, I believe it was. And at the time, I had a dental colleague who was nearby. So I said, "Hey, do you mind I feel like it could be this tooth. Could you just walk across the road and talk to my friend who is a dentist and have him take a look for me?" So he went off, and I started seeing some other patients. Later in the afternoon, I got a phone call, and it was my good friend who's a dentist, and he said, "Hey, Andre, I have this gentleman in the chair with me, and I need to talk to you." I said, "What's wrong?" He said, "Well, you asked me to take a look at this gentleman's tooth, and to be honest, on that tooth, he has a crown, meaning he has like a cap placed on the top of the tooth. Now, the problem, Andre, is that this man had some very expensive dental work done. And if I remove this crown and there's nothing wrong with the tooth, he's going to be very unhappy." And I said, "Hey, man, I'm pretty confident that there's something wrong with that tooth. So maybe our friendship is going to break down as a result. But, or maybe the man will never speak with me again. But I'll take that risk. Please remove the crown." He said, "Okay." And he hung up. And he called back later in the afternoon, and he said, "Boy, Andre, I am so glad I removed that crown, because from all my examination, I couldn't really tell if anything was wrong. But when you gave me the go ahead, I removed it. And as soon as I removed that crown, there was just so much inflammation contained within the teeth. I know some of you may be eating or otherwise sensitive, so I didn't tell you exactly what he said, but let's use the word inflammation. A large amount of inflammation gushed out of the tooth in question. And of course, I could tell you story after story of the same nature, where intervening and helping patients with their dental issues help to restore health to the rest of the body. So, what's our summary here? Well, the summary is that most people do not make the association between the teeth and overall health, accepting just the general recommendations to brush your teeth regularly and the usual stuff. But there's a deeper connection, both structurally and electrically, and I think it's something that if you know about it, you know about it. If you don't, you don't. But we're healthy reasoners, and the whole aim is to give you unfiltered information about your health and wellness. So we're talking about it today. And let me see if I can pop out one more story. Yeah, this one is a good one. So, so in another case, I had a middle-aged lady who was diagnosed with cervical cancer. And she came to see me. I'm designing her protocol for naturopathic treatment for her cancer itself. But as a part of my due diligence, I asked her a few questions. And at the time she came to see me, she was just howling in pain. Her lower abdomen and pelvis, where she was just having intense pain all the time. And on that particular day, it was really, really bad. It was difficult for me to watch her in pain. It's difficult for me to watch any patient in pain. And those of you who've been to the office will know that many times I'll prioritize a patient who is in pain, even if it means those in the waiting room have to wait a little longer. So in this case, I said to her, wow, that pain is really bad. I asked her about it and examined and kind of tried to figure out, okay, so you have cervical cancer. I wonder what else is on that circuit. And I said, I think if I'm understanding you correctly, you should have a problem with this particular tooth. And she said, Doc, how did you know? And I said, what do you mean? And she said, take a look at it. And when I looked at the tooth, there was literally a hole in her front tooth, like an actual hole. And she said, oh my gosh, Doc, that hole has been bothering me for a while. And sometimes the tooth hurts, but right now it's my belly button. So I said, well, if we're right, I should be able to numb the area of the tooth, and that should help you with your pain. And I actually have this on video. Obviously can't show it because of patient privacy concerns, but one day she may allow me to show it. And on the video, you will see her writhing in pain on the examination bed. And then you'll see me give the injection to the tooth. And you'll see within, I'd say 3 minutes, you'll see her whole facial expression changes completely. And it's just absolutely obvious that something has happened. And then she has this kind of deer in the headlights look. And I say to her, well, what's wrong? And she said, Doc, the pain just totally disappeared in my lower abdomen. And I said, what do you mean? She said, 1 second it was there, and the next second it was just totally gone. Her relative had a very strange reaction that day in terms of what she thought of me. And though I tried to explain to her that it was just purely medical, science, she, I guess she was basically saying there's no way that could have happened. But it did. And the patient was absolutely pain-free, not just that day, but for some time after. And that helped significantly with her ability to receive treatment. All right, that one was pretty cool. There are more sensational ones, but I think I'm going to be wise, and we're going to close for today. Thank you so much for listening. And for those of you who have been putting off that dental appointment, please go to your dentist and tell him or her that Dr. Andre sent you and told you that you needed to get an examination done. And to those dentists who are watching, you're welcome. See you next time on the Healthy Reasonings podcast. Love you guys.
Thank you for listening to another episode of the Healthy Reasonings podcast. Remember to subscribe to this podcast so you can be updated as soon as new episodes are ready. If you have a question, send us a voice note on WhatsApp or a WhatsApp message. The WhatsApp number is 1-876-405-7831. For more information or to become a sponsor, please email wellnessdocjamaica@gmail.com. See you soon.